HD. Now this is a neat one because this is a test that we've always wanted that actually can do a trial run of the surgery in the computer.
Really?
Okay. So up here we actually corrected your nearsightedness up here in the computer. And down here it shows us not only could you be 20/20, you could be all the way down to 20/15. So this is the first time we've actually been able to predict the results on how good your vision could be. And what this means, you don't have anything else wrong with your eyes other than the nearsightedness. Okay. It also, your optical scatter index, or OSI, is supposed to be less than 1 and yours is 0.5. And it's supposed to be in the green and you pegged it down in the green. So this is all good stuff, and it means that the optics of your eye don't have anything else wrong, like a cataract or bad dry eyes or cloudy cornea. So this is good stuff. And then we did a little test on your eyelid oil glands. And these oil glands we found are very, very important because this is a new test. It's only been around several months. But being able to look at these glands, we now know they're very important because they produce a protective film that keeps our tears from evaporating. Okay. And most people who have dry eye sensation don't really have a lack of tears, they have a lack of these oils.
Okay.
Okay. Now yours are very good because all the glands are there. But what they're supposed to look like, they're supposed to be kind of long and thin.
Okay.
Okay. And you can see yours are a little shorter. And when the
Are they there here or not?
They're lost there.
Okay.
Okay. Then you can see they're kind of, we're losing them a little bit over here.
Okay.
Now, what causes damage to allergy, inflammation, and contact lenses?
Okay.
Okay. And what we're finding now, and now that we're doing this test, we're seeing that people who have worn contacts for a lot of time are losing some of these. Now, the good news is yours are going to recover, you know, if we can get rid of contact lenses. And also, we're going to teach you a little bit how to clean them a little better because nobody knows how to do it unless we teach them. But yours are not bad, and we're not going to have dryness problems as you get older.
Okay.
Okay, we're just going to make sure we can keep these active. Every time you come in, every couple of years, we'll get another picture and make sure they stay good.
Okay.
So they're fine, but we could make them a little better. Okay. And then we looked at the cells on the inside of your cornea, and they're perfect. Okay. Now these can also be damaged by contacts, and yours are fine. And then we pointed your eye straight up. Okay, and now we're going this way. So there's your cornea. That's where we do modern laser surgery. That's where contact lenses are too. This is a flash bulb, and this is the lens inside your eye. Okay, and yours is normal. That's left eye, and this is right eye. And then we asked the computer to do a digital analysis of the inside curvature, outside curvature, and thickness. And then we made a map. And this map tells us, can we fix it, and even tells us how to fix it. Okay. Now we start down here in this area, and this is your corneal thickness. So we back up a step, this is from here to here. Okay, and that's that blue machine that rotated around at the end there. Okay, so it gives us all the way around. Now, normal corneal thickness is thinner in the center, and thinner is in the yellow. Okay. So you're thinner in the center like you should be. And it's supposed to gradually get thicker as we go to the edges. Okay? So your left eye is normal and your right eye is normal. It's thinner in the center and it gets thicker as we go to the edges. Second part of the test is this number right here. 498 in your right eye, 496 in your left eye. And that's normal. But normal is between 480 and 600, so you're thin normal. Okay. Okay? Nothing wrong with that because you're normal. But it does make a little difference on the procedure choice, so I'll come back to that in a minute. Okay. Then we come over here, and this is where we start noticing how steep, medium, or flat the cornea is. And the cornea itself is shaped like the point of an egg. And if that point is too steep, people don't have very good night vision. Okay. If it's too flat, they don't have very good night vision. There's kind of a sweet spot in the center, and yours is a little too steep. But that's actually great when we're going to do lasers, because lasers make it flatter. Okay. So you're going in the right direction. Okay. Okay. Matter of fact, some people are already flat and they're going the wrong direction. So this is a good thing. And then we come up here, over here, and you probably have not been told this much in the past, but you do have a little bit of astigmatism.
Really?
And astigmatism means it's not perfectly round. Remember that point of the egg, yours is a little bit oval. Okay. That's in your left eye. And if we go to your right eye too, it's a little bit oval.
Okay.
Okay. Now, the reason it hasn't been talked about very much in the past is that you're mainly nearsighted and have a teeny bit of astigmatism.
Okay.
But if we're going to correct it, we correct them both.
Okay.
Because the lasers can make this round. That has a tendency to give people a little better night vision.
Okay.
So you kind of have these two things that says, better night vision is kind of on our list.
Okay.
That doesn't mean we'll get it for sure, but there's a chance for it because of both of these here. So you're definitely a candidate, and you actually qualify for the procedure that fits your eyes. Okay. Now I talked about your thinner cornea.
Mm-hmm.
Okay. There's two major ways that we do laser surgery nowadays.
Okay.
They've both been around over 20 years. They're both extremely common. One, in this category, is where LASIK sits. And in LASIK, and also what's called SBK, which is the advanced version, or intraLASIK, a bunch of terms here, we lift up part of the cornea, do the laser, and put the top back down. Mm-hmm. Okay? And that we kind of hide the surgery, and that's one of the hallmarks of that procedure. But the problem is that flap that we make has about 100 microns of cornea that we can't use to correct your vision. Mm-hmm. Okay? So when people have a thinner cornea, we move over to the other one and we don't do the flap.
Okay.
Okay? Same laser, same procedure, costs the same, it's the same thing, takes the same length of time. But without the flap, we have the whole cornea, and somebody's a thinner cornea to be able to protect the eye. It's actually less surgery.
Okay.
So when people get this one, they kind of go, oh, I get that one and it's less surgery. Mm-hmm. Now, the difference between the two is very little.
Okay.
But the recovery is different.
Okay.
Okay? Because in this one, because we've hid the surgery, the vision comes back faster.
Okay.
As a matter of fact, we did a study 7 or 8 years ago where we did patients who are a candidate for both. We did one in one eye, one in the other eye. Mm-hmm. And then we followed them for years in a multi-center study. Pretty neat study because the patient could walk around all day doing this and seeing which one they liked better. Mm-hmm. And there was no difference in vision, no difference in dryness, no difference in night vision, there was no difference in complications. They were equal. But the vision recovery was slower in the one we have to do on the surface like yours.
Okay.
Okay. And especially because you're moving and all those other things, we'll talk about that.
Okay.
Because that's one of the things that we want to do is because we can kind of work our schedule around yours.
Okay.
Okay. Because it's one of the things we have to see you 1 day after surgery and 4 days after surgery.
Okay.
And your vision during that first week is okay.
Okay.
But it's not super crisp and sharp.
Okay.
Okay, so that's kind of why we have to do a little strategic planning on that. We've also put a brochure together for you that tells you what to expect every day.
Okay.
Okay, and especially taking care of kids and driving and all those other things, you just want to plan carefully. Mm-hmm. We do patient satisfaction surveys, and you'll get one after the surgery, and at least twice a year I get a report back from that as I wish I would have read that brochure. Okay, so that's why I always remind people, because it tells you what to expect. So you need to fit procedure around your schedule and your lifestyle. Will fit around you. Okay. But it is something that you're a great candidate, and it's something that you'll really enjoy, taking the kids to the pool, traveling, airplanes, everything else, because contact lenses are pretty artificial, and they really don't, you've got a little bit of damage to your glands from them, but they're kind of something nowadays that we wear until your eyes mature, and then we move on. Mm-hmm. So we might as well move up to getting your vision corrected just because you're a great candidate. Okay, thanks, and thanks for what your husband does.